So let's talk about the steps for making a crown, the dental lab steps. There's a step, clinical steps. The clinical steps are, the dentist talk about the patient, ask about the insurance, make the diagnosis. The tooth need to be crowned. Most of the teeth that need crown, they have very big fillings, or they need a root canal, or they have fracture. So you want to protect the remaining tooth structure with a crown. That's the indication of a crown. Other indication crown can be for over implant. And sometimes even you can do if you have a partial denture and the remaining teeth receive a clasp or a rest. Sometimes you need to protect these teeth from the assault of partial denture, whether a clasp, whether a rest. You can do, you can make a metal or metal ceramic crown to protect that tooth. So there are many indications of crowns. The diagnosis, and take an x-ray, see the tooth has a root canal or need a root canal. You should first remove all the decay and make sure there is a space for the future crown. So you have to prepare the tooth, remove the enamel, and most of the crown sit on the dentin. So the enamel will be removed because we need the space for the metal or ceramic to be built in on. And they do, as a tooth preparation, maybe one lecture we talk about tooth preparation, there are different type, how you prepare the tooth. Technically, you have to create a smaller tooth. It's almost the same anatomical structure, like where's the buccal, where's the lingual, and you think about the future mastication, where's the bite is going to be. So most of the time, the preparation on the occlusal side is more than on the lingual side. On the labial, on buccal side, usually we take more part of the tooth because we need, especially if we work with metal, we need the space for the metal and space for the ceramic. But you can do in the lingual side or the palatal side, if the patient want, we can do just metal on the palatal side and metal and ceramic on the buccal side. That's all. These are the clinical steps. So when the dental lab technician will receive the impression, or you receive a digital scan, we send it to you. So that these are, we're talking about laboratory steps. So what the crown? The crown is restore the damaged teeth, improve aesthetic. This lecture anyway. So the time can be full ceramic crown or metal ceramic crown. And nowadays, because the ceramic getting better and better, getting more stronger, getting advanced, we have the Emax now. It's very strong, and you can make it in very good shape and color, can fit the teeth, and many dentists they use it. And some of the dentists, they like zirconia, which is very strong, but usually need to be digitally scanned. In general, if you don't work with a dentist, you work with a dental lab, you receive an impression usually in a container, and you have usually the reception area for every dental lab. They clean, they organize, they give label, and they sterilize. Usually it's sprayed, but most of the dentists, they do the spraying and the cleaning when they take impression, and they send it back to you. And some dentists, they will pour the impression. Some of them, they don't. They send it to you. You do the stone casting, and you send the prescription, what's called the color, the shade, the tooth, and usually always ask for the opposite. If they send you lower, you need the upper, because we need to build the tooth an occlusion. And they send you these, the shade and the color, the tooth, the design, what they need, the design. They want a full metal crown, or they make it porcelain fused or zirconia, depends on whatever they send it to you. And usually you receive it either you do fabrication, you would do a cast, or you can get it as a digital scan, and you work on your 3D on your CAD CAM software. The 3Shape is the most common now, and then you do the dye preparation. This is the dye preparation. That's what we're working on in the dental lab. Ari, you missed that because we are working on to cut the teeth individually, and then we prepare them. It's one of the step in dental crown preparation to separate the tooth. It's a little bit tricky because we're working on stone, very smaller stone, and you have to cut it, and it needs to be perfect. So the more you work with it, it will be better. But now, if you work with the digital, it would be different. Digital is everything on. You have to be good with the software. But my experience, I tell you, you have to learn the traditional way, then go digital, because you cannot go back digitally. Digital, everybody can do it, but if you don't work with your hand, you will have an idea about the mesial, distal, where's the finishing line, where's the gum line, where's the occlusion. Yeah, so that's why we have failure of digital, because some people, they don't know the traditional way. The traditional way will give you more experience and give you advantage. And then when you do the software, you can learn it within a few days. And they will usually send you YouTube or videos to learn. So always advise you to learn the traditional way. If it's metal, you have to do the wax up. Yes, that you need a carving. You carve the tooth structure, and you do wax up. Sometimes you do wax up. If you work with a dentist, the dentist take impression and give it to you, and the patient is still there, and he ask you to build the wax up to show the patient. You build the wax up, and for many reasons, to show the patient. The patient will look at it and they see the buildup. How is it? And also the dentist, when you prepare the tooth or the teeth, and you build the wax up, he will have an idea what's the future crown or future bridge gonna be. So sometimes the wax up, you do it inside the clinic, or sometimes they take impression, they put temporary and send it to you, and you build a mock-up wax up and you show them. So this is one way, but in general, if you work with metal, you have to do wax melting. You have to build your your crown from wax, and you do the sprue thing, and it's just like if you have an idea how to do, they do jewelry, they do rings and gold stuff, it's the same. And the dental crown bridge build up on jewelry making, and the jewelry making build up on, where when the jewelry making build up on people making the church bells for metal. And before that, people do, when they do metal casting, they do it for weapons. So these are thousands of year experience. When they do weapons, you know how they do weapons, and they cast a weapon a long time ago. Like imagine a sword. They build the sword from wood. They cut it and they carve it, and they put special sand, and they put the sword in that sand, and they tap the sand. The sand will be very tough, and then the sword will take the shape. The sand will take the shape of the sword. They remove the sword, and they and they melt the metal, and the metal take the mold of it, and they polish it. Then they started more complicated, like when they do when they start making balances and making other stuff. But then, because it gets smaller, when they start doing jewelry, when they make gold and silver, they have to have the wax. They start doing the wax and melting the wax because it's very small. And then dentistry pick it up after that. If you work with the metal ceramic, you have to build the metal first, metal frame. Then the ceramic will be layer by layer. You add the layer. There's opaque, there's dentin, there's enamel, and there's a glazing. Usually take very long time, but you will learn to do it and you will like it. And then most of the layer by layer, I think one of one of the student, she has, Brooke, had layer by layer lecture, but I said it's very complicated for you, so let's do the other thing. So the layer by layer, you add layer by layer. These are special powder, special liquid. You mix them together, and you brush them on the tooth, and see the thickness, and then you put it in the oven. The oven has adjustment. It's pre-adjusted for enamel, for dentin, for opaque or glazing. You just click on that, and they give you the time and the temperature for each one of them. And then after that, you polish it, you glaze it. You sometimes some of the dental lab, they polish it and check the check the bite, and then they do glazing, because glazing is very thin layer, so it never affects the thing, because usually when you adjust it, you remove the glazing part, make it rough. So you finish the occlusion, although most of the book they said finish the occlusion first and then you do glazing, but sorry, most do the glazing first and you do the occlusion for later. So most of the dental lab, they do occlusion, they remove the high spot, that they have all the movement, like centric relation, or eccentric, protruded left to right, all these movement you have to think about it, because sometimes when the bite is on, the tooth looks fine, but when the patient move left to right, there's interference with the cusp, and so you have to remove that interference. And then you check the quality, check the margin. The margin is the most common cause of failures of the of the crown. Margin is a break. The margin will be under margin. The food will get there and get decay in, and its failure rate high if you have decay underneath. If the margin over the gum, you will end up with gum recession, especially anterior teeth, and you have the red gum line. Maybe you've seen people with the fake crowns, the gum look red, and because inflamed, especially younger people. Older people, they will have gum recession and they look more ugly, and they need to replace it. And we have one of the teacher, maybe if you see her, she has lateral crown. The shape change, the color change, and the recession, the gum receded. But she doesn't care. She said, I'm fine. It's been a long time. But if it need to be replaced, if she got, but because of dental care is very expensive, she didn't want to change it. But it looks fine. So one of the complication of failure of crown is the margin. What do you think other causes of failure of the crown? Anybody? We were talking about one of your lecture, Brooke.
Trauma.
Trauma to what?
Like trauma to the jaw. And then by proxy it would be transferred to the crown.
Yes. So trauma to periodontal ligament, maybe high spot, and you will have gum disease. Let's see what much biting force. Yes. There's one thing, fracture. I think Brooke talked about fracture of the crown can be fractured because of high spot.
Oh yeah, she mentioned that.
Yeah, fracture can. Other cause of failure for crown. Think of decay. If there's the margin is not sealed enough, the food will go underneath, and they get decay, and the tooth get infected. And the pulp will be involved, and you have to remove the crown. Sometimes you don't have to remove the crown if the tooth infected. And sometimes you just drill in the front and the top of it, and you do root canal, and you make the fillings. You fill it with the regular filling after root canal. But most of the dentists, they remove the crown and you do the root canal and do and they build and make another crown. Do you think of other complication?
So we already covered trauma, biting force fracture, and poor oral hygiene.
Yeah, yeah, decay and gum disease always one of the main. If any complication of the teeth, decay and gum disease, even like partial denture, the clasp can cause decay and trauma. Any dental restoration will be
Can patients
done.
be I'm sorry, can patients be like, or are there any cases where a patient's been allergic to the materials from a prosthetic?
Yeah,
Like is
metal.
that
All time ago they use the metal, different metal, and they will have allergic to chrome and. But nowadays, all these metal they don't use them, so we have less chance of uh, people have allergy. And there's a have you heard of a galvanic phenomena?
no?
Galvani, the guy, he's Italian guy of electricity. When they're remember when there's when they eat frog legs, and he put two metals in the frog legs, and the legs start moving. Remember that's galvanic.
Oh, okay, yeah.
So in the mouth, if you have two metals, like one amalgam, one chrome cobalt, sometime and there's the fluid, so it will be like a small battery because you have two metals and there's a fluid with ions. You will have big pain. So they call it galvanic phenomenon. It's very rare nowadays because these metal, no one uses these metal now. Most of the time they use precious alloy and gold and platinum, which is very rare people, they have allergy to these things. Allergic to cement, maybe, and the cement that glue the teeth. And they hate the cement because the cement will go under the gum and cause inflammation, especially when you do implant. That's the thing. Damage to adjacent teeth, damage to the opposite teeth. That's all. Okay. All right. Let's see. And then clean and package and ship it to the dentist and deliver. Usually the packaging is very important. Okay, this is text. Yeah, the crown can be fractured, yes. And so the dental lab has advantage. The dental lab has very benefit because long time ago, the dentists without dental lab, they have to make crown on the patient, inside the patient mouth. But the invention of impression or making cost, that's a great dental lab. So you can work without the patient there. You create these things. Remember George Washington when they have ivory denture? So the dentists, all dentists, they go there and they carve the dentist while the patient's sitting there, and they adjust it and they check it because they didn't take impression. They put it there, so it takes hours and hours, and the patient sit there. Imagine. So nowadays, because of the dental lab, save time, benefit. You can train them and do all this magic, and but there's always challenge, the cost. Especially with the digital dentistry, there is cost, the and miscommunication with the dentist. Always keep communication with the dentist. Tell them I need this. I don't like this. This impression is not good. I need another impression, and the bite is something wrong. Is off. I need the space. This is always between the dentist and the lab technician is the space. The dental lab technician needs the space because you have restoration. Remember, the dentist prepare the tooth, remove the enamel, give you space. If they give you small space, your restoration is going to break. And guess who's going to blame? You're going to get blamed as a dental lab technician. But always need the space. You need the space. You need margins. That's always like that. Think about it. Zirconia now is very strong. Zirconia is a 3D printed, and usually it's not 3D printed, it's milled. It come a disc, and there's a bear will mill the zirconia is more stronger now, and you can use gold. I have a friend, he's rich, and he has gold inlay, and he can change it, but he doesn't because it's very good and it's still there, and he doesn't care about it. It's gold inlay on the molar, and looks It looks nice. Why have to change it? I think it will stay more than if you do ceramic crown or more because the gold is very good. That's a part of the color is very good. But now the Emax is good too. And so conclusion, dental crown is a combination of science and art, technology, and it's a teamwork for you with the dentist, with the somebody take impressions, with the patient. Is a teamwork to do that. So always, if you take one idea about this, is communication with the dentist and the steps how to make good crowns. Let's see the questions. Oh, yeah, the cost of the crown depends on the area, depends on, would be cheaper, I think, than Emax. But you need to have the dental lab who do that. Some dental lab, they don't do metal nowadays because the metal need a lot of things. You need the oven, you need the centrifuge, all these things need to be done. So any question? Ideas?
No, I asked all my questions throughout. But for, I guess to speak to the subject, because so I have I kind of cheated a little bit, but I got it to where it wasn't cracked this time and I could remove each individual tooth. And now I'm waxing up the models right now because I have two crowns that are on either that are what is the word that are abutting like a tooth. And so I'm trying to make them separately. And because I don't have the top, or I have the top arch, the maxilla arch, and I don't have the mandible, I'm having trouble trying to get the occlusion right. I'm trying to just basically copy the mirroring tooth on the other side, but I'm having trouble trying to get like the occlusion right without the bottom part.
So do you have like as a patient, lower patient, or you have like a general cost?
It's a it was one of the pre-done casts.
Yeah, we have take the upper. Usually they fit the same. It's always like a general. We take the lower but the upper. Try it.
Okay.
If
Because
it's fit,
I have a couple models, like just random tooth models. So if it's general, I can just try to press it against the like the bottom of one of those.
yeah, just so for training, so you can see how much space you need. That's the thing. And the other thing, people when especially if you've a tooth fracture for a longer time, the opposite tooth will grow, so it will give you more, give you less space. That's another thing with the crown, if or bridge. Like if you have missing first molar, and you prepare the premolar and the second molar here, the upper molar will grow more faster, grow more to the area because there's no opposition. So that sometimes the dentists have to prepare the upper, remove some of the occlusion to have a good bite because it will grow. So that's the thing. And the other thing that if they're missing a tooth between them, they grow like this. They tilt it toward the space. Yes. So the opposite arch is very important. Yeah, you cannot build the crown. If it's partial denture, you can because partial denture, the dentist uh, uh, can remove a little bit from acrylic. But when you work with the ceramic and zirconia, it's not easy to be polished. All right, maybe ask Bailey. Bailey, what do you think the decision of making a removable appliance or fixed appliances? What's depends on what? Fixed partial denture or removable partial denture? I guess she's not there. Hmm. Cody, what do you think?
She's trying to get the mic.
Okay, go ahead. So what do you think? Removable appliances like removable partial denture or fixed partial denture like a bridge?
Would it be removable?
I know what's the indication like. But I have a patient. This is the picture. Did you see the last picture? Let me show you the last picture. Let me share it. Um, okay. So what's the indication of this? You can do partial or you can do fixed. Technically, you can do both. If the patient, because partial denture is cheaper, less time, take less time, less preparation. So it depends on the patient and the dentist's skills. So this one we can do it with partial denture. We can do, but it doesn't look very good because it's anterior teeth, and you have to put the clasp in the anterior teeth. And so the location of the missing teeth, if it's anterior, most likely you want to do fixed. The span, if it's too many teeth are lost, the remaining teeth will bear the bite on the of the bridge. So if you have very long span of missing teeth, you have to do partial denture. But so they add the all teeth to carry the missing teeth, which is lateral, canine, I think first premolar and second premolar. And so they add all the teeth. But there's always disadvantage of this, because if it's one fail, one abscess or one fracture, you have to do a whole thing. So, or you can do indication, and maybe we'll give you a full lecture about the diagnosis and treatment plan, because the treatment plan is very important, because this case we can do first we'll see what's the patient complaint. This is obviously female patients look for aesthetic, phonetics, and what they need and the cost. How much do they have insurance? So if she doesn't care about the color of the teeth, you can do 2 implants, lateral, canine, and 1 premolars, and you can do bridge on them. And but she doesn't like the color of the teeth, and you can do bridge all of them. Yeah, maybe we can discuss the treatment plan, because it's very long, and you have to think about all the thing. How many teeth missing, the patient age, the cost of the treatment, availability of the treatment. Some treatment are not available, like if the patient need sinus lift or need a big surgery, and you live in the rural area, there's no oral surgeon, so it's a different area.